Colleagues, it is my privilege to introduce an act to establish a national framework on food allergy. I'm especially pleased to be introducing this bill in the month of May, which is Food Allergy Month. I want to thank by thanking Food Allergy Canada, a nonprofit organization which is dedicated to improving the lives of Canadians faced with food allergy. Along with Senator Mohammed Iqbal Rabalia and Member of Parliament Ben Lobb, we hosted a roundtable in February to consider this issue. Other senators who participated were Senators White and Nuance, and I thank them very much for being part of this. Food allergy is a serious chronic disease. About 7.5 of Canadians, some 3 million people, have a food allergy, including 600,000 children. Every year, 25,000 infants are diagnosed. 40% of those with a food allergy are allergic to more than one food. These millions of Canadians are living with life-threatening health conditions. Reactions
to allergens can take different forms, but just because a past reaction was mild does not guarantee that future reactions will be.
I don't know having a food allergy means being perpetually vigilant. Peanut allergies have, I think, have had a fairly good awareness, but try avoiding milk in a situation where it's not just a milk intolerance, but an allergy, a life-threatening allergy to milk. This is not just a food allergen, something which can be unpleasant and can be avoided. We are talking about an allergy, an abnormal reaction to the immune system. It can be life-threatening. You can unknowingly be exposed to something that can kill you, and to avoid, you are somewhat at the mercy of the behavior of people around you. Eating out can be a real challenge. While food allergy has always been around, it used to be a fairly uncommon condition. In the industrialized world, food allergy prevalence started rising in the 1980s. This increase accelerated through the following decades. Why this is, we still don't really know for sure, although there are a number of theories. Epinephrine is the drug used to treat severe allergic reactions. It is significantly underutilized due to barriers such as cost, access to a device, and lack of education as to how to use it. One issue that has been reliant is a single supplier. If that supplier were to be cut off, millions of Canadians would be vulnerable. We have developed promising new techniques that can help prevent food allergy and reduce its severity for its sufferers. There has been a fundamental shift, and I want to just highlight this. There's been a fundamental shift in how we approach this. It is not advised, as it was 20 years ago, for children to avoid potential allergic foods. Parents are now being told to get those foods in the diets of their children at an early age. The groundbreaking 2015 LEAP study found that introducing peanuts in infancy reduced the development of this allergy by 80%. Additionally, oral immunotherapy is being used to aid sufferers by introducing small amounts of an allergen at an early age. I'm pleased to report that in the last month, Health Canada approved a new epinephrine nasal spray, which is wonderful news because its ease of application and because it diversifies our supply of essential medications. Access to allergists, however, remains limited, particularly in rural and remote areas. The bill now before you seeks to take that leadership. It mandates the federal government to work with provincial and territorial health departments, Indigenous governing bodies, healthcare professionals, patient groups to develop this national framework. The framework should identify ways of reducing incidence of food allergy, the risks in which food allergies are exposed. These may include improving diagnosis and care, expanding the use of new developments, improving access to allergists, etc. As I try to complete this on time, I want to close by just highlighting one thing. The number of this bill is extremely wonderful, 247. The thing about food allergy is it's a 24/7 issue. There is, kind of funny, kind of nice, one of our team discovered that today, But it's really important. The thing about a food allergy is you are allergic 24/7. You can't say, well, I'll just take a pill and have a little bit of peanut butter. You can't say, oh, well, it's a birthday party, we'll look the other way. There is no room for error. So on the one hand, it requires 24/7 vigilance. On the other hand, it requires 24/7 for us to be working on a cure for this. With that, I thank you, colleagues, for your indulgence.